Hi, I'm Bob Roth, managing partner and co-founder of Cypress Home Care Solutions. Since 1994, we've been helping older adults in the Phoenix community age gracefully and safely in the place they call home. Since 2014, I've been bringing you Health Futures, Taking Stock in You, a show dedicated to helping you live a longer, healthier, and happier life. Be sure to subscribe, rate, and review this podcast, and enjoy the show. Welcome to Health Futures. I'm your host, Bob Roth, and I'm really pleased to have here in the studio with me Dr. Sommer Gunia. She is a breast surgical oncologist with HonorHealth, and this is your third appearance on Health Futures, so welcome back.
Thank you for having me.
Good to have you. And I have a special guest here next to you. She's a patient of yours, but she's also family to me. My sister-in-law, Amy Dox.
Hi, good morning. Nice to see everyone.
Good to see you.
Nice.
So, Sonia, I think it would be really, Summer, is it okay if I call you Summer?
Yes, absolutely.
Okay. I think it would be great for our listeners to really get a little bit about your background. I mean, I could read that off, but I don't want to, butcher that. I want it to really be authentic and be you. So, can you give us a little bit about your background?
How far back do you want to go?
Well, where are you from?
So, I actually grew up in San Diego.
Woo-hoo.
My father was in the military, in the Navy, and so we moved around a bit. And my grandparents and my mother from Arizona. So I always, when my dad was out of town, we would come over to Arizona. So Phoenix has always felt like home to me. And so my mom remarried, and then I came over, went to Arizona State. I'm a grad from there, and then did medical school in Kansas City, and then went on to do my my general surgery residency and my fellowship in Ohio, kind of Cleveland area. Nice. But I've always loved Arizona, and I knew I wanted to come back. So I really only interviewed in Arizona for jobs.
And here you are. How many years have you been here?
Oh, I'm getting old. 12 years.
12 years. All right.
Yeah.
Well, for me, I guess my question is what inspired you? I mean, look, you go to medical school, but, what inspired you to choose breast surgical oncology?
Yeah. So originally my attraction to medicine was anesthesia.
Okay.
I originally thought I wanted to be a veterinarian, but I was a vet tech, loved the anesthesia portion.
Putting people to sleep.
Correct. Well, I thought that would be
dogs
great,
to sleep,
yes.
Yeah.
But then in training, I found that was a little bit too boring for me. It was only exciting in the beginning and at the end. And so I really found that I loved procedures. So I was terrified to tell my husband I fell in love with general surgery because it's a really tough, long, and women going into it still at the time was not as popular as it is now. And so I really just fell in love with it. So I went into general surgery, but I'll tell you, breast cancer is tough. Breast disease is tough because the great thing is there's constant research and constant newer technologies, better treatment. So you really have to stay up on things, which means it's harder on the test. So I really just felt like as a challenge to myself, I was going to dive in to breast cancer. And so I actually rotated with a very well-known breast surgeon that was local. I was lucky, and we wrote some papers together, and I just really fell in love with it. You're a general surgeon, but you get to build a relationship with these patients. I help them at the most vulnerable part of their life, and it's not like I just say, hey, took your gallbladder out, have a great life.
Right.
I actually get to follow them in their story and see their successes, and it's like building a family.
Oh,
so that's what I really loved about it.
I love that. You get to see them go through that progression, so
Correct.
to speak. It's interesting. Breast cancer treatment has evolved a lot. And, technology is, really fascinating in terms of what has been developed over the years. And, I have a cousin of mine that had breast surgery, had a lumpectomy or partial breast removal. And, she had these funky wires coming out of her. So, I mean, I would love for you to talk about, really some of the significant changes that have happened. And for you, I mean, you're now no longer in school. So these changes are happening every single day. So you're drinking from a fire hose. Tell us about some of these changes and how has breast cancer treatment changed?
So it's changed a lot, even since I've come out of my training. So when you talk about those wires, that's really to localize where the cancer is if you can't feel it in surgery and you can't really see it for ultrasound. And it's come a long way. Now we actually use things like radioactive seeds. There's other little markers that use radio frequencies or are magnets. So that's a really big thing, which is great for patients because with those wires, they used to have that done the same morning. So it really ended up being a long day for the patient, starting out, 4 hours before their surgery. And then, it can be a little bit painful, but no matter what, they're stressed. With these different modalities that we have now, we can actually put these in up to 10 days beforehand. There's some that can actually stay in indefinitely. So that's a great thing when it comes into marking these areas.
Right.
Something else that is great is with lymph node surgery. Way back when, they used to do full axillary dissections where they would take out probably 13 plus lymph nodes, where that really can increase the chances of getting that swelling in your arm, which we call lymphedema. And so we've really come a long ways where now we're doing sentinel node biopsies where we're just removing, an average of 2 lymph nodes. So it really decreases the risk of that happening. And one of the ways that we find these special guardian lymph nodes is with an injection called technetium 99. That used to be done preoperatively when the patients were awake. And I was nice enough to give my patients numbing cream, but it's still scary because if you go online, a lot of ladies say that was the worst experience of their day.
Wow.
Now we're actually at HonorHealth able to do it in surgery. So one more thing ladies don't have to go through. They're already asleep when I do that. Technology is my baby. I'm kind of a technology nerd, and I'm actually the guru from my group for that. And so something else that's come out now is called Spy-Fi. And I was part of the film.
Sounds so cool.
It is really cool. I know. And I love Star Wars, so this is my thing. Where it's actually the film B trial I was a part of, but it's using indocyanine green to actually map out the lymph nodes, because prior to that we had lymphoserum, which is a blue color, or methylene blue. And those can have their pitfalls. And to me, it didn't really work real well. And it could have just been my technique. But with the Spy-Fi, we're using indocyanine green, which, of course, after the patient's asleep, 2 little dots are injected in the breast, and you can actually map out the lymphatics underneath this special camera. So now, not only do the lymph nodes make noise, now they glow. So it's definitely made me become a better surgeon.
Wow.
And of course, they're using Spy-Fi for other things as well. But as far as lymph nodes go, that's amazing. Can I do one more? That's my favorite.
The mic is yours.
My new, that's not mine, but the newest technology that I have tried out and HonorHealth has decided that, yeah, this is really great. It's called perimeter imaging. And this is the same technology they use to actually look at your retina when you go to the eye doctor.
No way.
Yeah, it's very cool. It's called, I have to write it down because I forget some of the words, but it's called optical coherence tomography, where it's looking live in surgery, where I actually take the lumpectomy out and I can actually look at the margins live in surgery. And this is the first technique I have found that I'm really impressed with. Nothing's 100%,
right,
but I've been super impressed, where I can tell you we did a look back for 3 months for me, and I did 94 lumpectomies and only had to take 3 patients back. That's huge.
That is
because
huge.
If you looked nationwide, it's about a 25% take back. And I would say if you had a breast surgeon that's fellowship trained, or just a breast surgeon period, that's all they're doing, you might be more like 10% might be the average. So
my math says it's like 3 to 4. That's where you're at, which is incredible.
Yeah, I mean, there's nothing more heartbreaking than taking a patient to surgery and thinking we're going to come out cancer-free and having to give them that call and say, unfortunately,
we got to go back.
We've got to go back.
Yeah, that's got to be really hard.
Yeah.
And for me, Sommer, how are you able to digest all this information? I mean, it is coming at us so fast, and yet the old days, we got them, whether it be through snail mail or maybe a fax. Today, information is flowing really fast, and obviously you're looking for evidence-based information. You're looking for stuff that's been has very supportive backgrounds. Tell us about how you're looking at this, because I'm sure you're looking at some other innovations right now, because you're a techie. You're into that stuff.
I mean, definitely not computer techie, but hands-on.
Hands-on techie. Like. There you go.
As far as breast surgery goes, I'd say majority of us as specialists definitely go to conferences at least once a year for the specialization of breast surgery. And we get a lot of hands-on and looking at the new techniques to see if that's something that we want to incorporate into where we're practicing. So we're fortunate in that you can really do a lot of hands-on and really just see a lot of things, and also the different presentations, the publications. And so that's really amazing. And then sometimes you just bring it into the hospital to do a trial period and see if it's something that actually works for you, or if it's as successful as they say it is.
Right. Right.
Yeah, other ways are we do a breast cancer tumor board in
Hmm.
Scottsdale every Tuesday morning with HonorHealth. And so that's a collaboration with all the different specialties. So medical oncology, radiation oncology, genetic counseling, plastic surgery, breast surgeons. And so it really helps you stay up on all the new up and coming techniques that are happening. So all around. And everybody goes to conferences and brings it back.
And obviously, peer reviews are things that you're looking for, and you have peers that you follow all the time, and I'm sure they follow you as well.
I absolutely do
Yeah.
that I follow. And the great thing is that part of the American Society of Breast Surgeons, which most of us are part of, they frequently put out the new publications, and we do CMEs and those kinds of things. I have to say, though, it might surprise people, but I'm not a huge social media person. So I'm more of an in person
Thanks for listening to Health Futures, Taking Stock in You. I'm Bob Roth, reminding you that living well isn't just about years, it's about the quality of life and connections. Follow and share the show, and join us next time for more on how to live a longer, healthier, and happier life.